Welcome to a campus too. How are you doing, everybody? Let us see about colorectal cancer. What is colorectal cancer? Colorectal cancer, also known as bowel cancer, colon cancer or rectal cancer, is cancer that develops in the colon or rectum, which are parts of the large intestine and digestive system, and often starts as a polyp. Here's a more detailed overview. Where is colorectal cancer located? Colorectal cancer originates in the colon, large intestine, or rectum, the final part of the digestive system. The common name for colorectal CA is bowel cancer, colon cancer, or rectal cancer. Development of colorectal CA. Colorectal cancer often starts as a polyp, a growth on the inner lining of the colon or rectum. Types of colorectal CA. The most common type is adenocarcinoma, which develops in the cells lining the colon or rectum. Here's a more detailed explanation of the causes and risk factors of colorectal CA. 1. Genetic factors. Inherited genetic mutations. Some individuals inherit genetic mutations that increase their risk of developing colorectal cancer, such as Lynch syndrome and familial adenomatous polyposis. DNA mutations is also one of the factors that affects colorectal CA. Colorectal cancer develops when the DNA in cells in the colon or rectum develop mutations that may make them unable to control growth and division. Polyps. Most colorectal cancers start as growths on the inner lining of the colon or rectum called polyps, some of which can become cancerous over time. 2. Lifestyle factors. Diet. High-fat, low-fiber diet. A diet high in fat and low in fiber, especially with a high consumption of red and processed meats, is linked to an increased risk. Processed meats. Eating processed meats, which are preserved by smoking, curing, salting, or adding preservatives, increases the risk of colorectal cancer. A sedentary lifestyle. A lack of regular physical activity is a risk factor. Obesity. Being overweight or obese increases the risk. Smoking. Tobacco use is linked to an increased risk. Alcohol consumption. Excessive alcohol consumption is a risk factor. 3. Other risk factors. Age. The risk of colorectal cancer increases with age, with the majority of cases diagnosed in people over 50. Family history. Having a family history of colorectal cancer increases the risk. Inflammatory bowel disease. Conditions like Crohn's disease and ulcerative colitis can increase the risk. Type 2 diabetes. People with type 2 diabetes have an increased risk. Radiation therapy. Radiation therapy directed at the abdomen to treat previous cancers increases the risk. Ethnicity. Certain ethnic groups, such as African Americans and Jewish people of Eastern European descent, have a higher incidence of colon cancer. Early detection. Early detection is crucial for successful treatment, and screening tests like colonoscopies can help identify and remove polyps before they become cancerous. Symptoms. Symptoms can include blood in the stool, changes in bowel habits, diarrhea, constipation, or a change in stool shape, abdominal pain, and fatigue. Treatment. Treatment options for colorectal cancer depend on the stage and type of cancer, and may include surgery, chemotherapy, radiation therapy, and targeted therapies. Now let us see some exercise on colorectal cancer. Now it is time to do exercise. Here are some multiple choice questions on colorectal cancer with explanations. 1. What is the most common histological type of colorectal cancer? A squamous cell carcinoma. B. Adenocarcinoma. C. Small cell carcinoma. D. Lymphoma. Answer B. Adenocarcinoma. Explanation. Over 90% of colorectal cancers are adenocarcinomas, which arise from glandular epithelial cells in the colon or rectum. 2. Which of the following is the most important risk factor for colorectal cancer? Smoking. B. Obesity. C. Family history of colorectal cancer. D. Alcohol consumption. The answer should be family history of colorectal cancer. Explanation. A family history of colorectal cancer, particularly in first-degree relatives, significantly increases the risk. Other risk factors like smoking and obesity also contribute, but to a lesser extent. 3. Which of the following conditions is a known precursor to colorectal cancer? A. Irritable bowel syndrome. IBS. B. Crohn's disease. C. Ulcerative colitis. D. Both B and C. 1 minute is given to answer this question. Answer is D. Both B and C. Explanation. Chronic inflammatory conditions like Crohn's disease and ulcerative colitis increase the risk of colorectal cancer due to prolonged inflammation and cellular changes in the colon. 4. Which screening test is considered the gold standard for colorectal cancer detection? A fecal occult blood test, FOBT. B. Sigmoidoscopy. C. Colonoscopy. D. CT scan. Let us give you 1 minute to answer. Answer C. Colonoscopy. Explanation. Colonoscopy allows direct visualization of the colon and rectum, enabling early detection and removal of precancerous polyps. 5. Which genetic condition is associated with the highest risk of colorectal cancer? Peutz-Jeghers syndrome. B. Familial adenomatous polyposis, FAP. C. Lynch syndrome. D. Juvenile polyposis syndrome. Answer B. Familial adenomatous polyposis, FAP. Explanation. FAP is caused by a mutation in the APC gene and leads to hundreds to thousands of polyps, with nearly 100% risk of developing colorectal cancer if untreated. Thanks for your attention. Please subscribe, comment, like, and share a Campus Tube. A Campus Tube is all about health science and technology. Goodbye.